Right. Americans, we are struggling with health care, whether they are living without health insurance, looking for a specialist that they won't have to wait weeks to see, or just trying to squeeze time into the day to physically see their own doctor.
Well, the good news is that more and more options are popping up online. These modern house calls are connecting physicians and patients, even those who've never even met before. When Roger Hoffman wanted a second opinion about the surgery he needed, he went to the web.
The doctor was able to ask me specific questions about my history of the injury and look at my hand and the condition that it was in.
In this case, Hoffman was 5,000 miles away from his doctor. They could have corresponded through email, but the specialist felt this was a better option.
There's some things that just don't translate well through email.
The two connected through a service known as Second MD. It's one of a growing number of online services such as American Well, Teladoc, and Consultadoc, all matching patients with doctors.
Most of the people who come to our site have a diagnosis, so they are trying to find out what are the next steps. Where should I go for surgery? Do I need the surgery? Do I go to a different type of doctor?
Glen Phillips founded Second MD after his daughter had a stroke during birth.
We were told to fly across the country to be able to have simple questions answered, and we didn't even know if the doctors knew the answers to the...
The American Academy of Family Physicians sees more and more of its members going high-tech with care, but feels it's important to point out you can only get so much help from a physician you never actually meet.
It really is more of a conversation and information sharing. They make a clear and, I believe, appropriate distinction that it is not the delivery of medical care, and they describe that specifically, that it's not diagnosing and not prescribing treatment.
The AAFP thinks that's an important distinction when people are paying an average of $170, which insurance often doesn't cover, to see the doctor online. Hoffman says it was worth every penny.
I spent more time with Dr. Eaton over the internet than I do in a standard office visit face-to-face with my physicians.
Hoffman even chose to fly across the country to have his specialist handle his operation.
I can't imagine a better technology.
Now, the AAFP did note there's definitely something for all physicians to learn from the fact that patients are seeking out specialized care online, and that it shows where the weaknesses are in the current healthcare system, including the notion of getting a certain amount of time with the doctor that patients schedule the appointment to see.
Well,